Well, I'm simply going to tell you a story about my prostate cancer. That, by the way, is the tram that I ride from our clinic building, which is down on the waterfront, up to University Hospital, where I do most of my work, which is kidney transplantation and penises. To make a long story short, my PSA was elevated, my prostate was biopsied, I had a robotic-assisted radical prostatectomy. Turned out to be a Gleason 3+4, PT2C, N0, M0. As I stand before you, I'm continent, potent, and my PSA is negative. For those of you who have to leave early, you may do so. These were my PSAs. On the left were the normal values for my age and for our lab. So in 2004, it was normal. 2005, it had dropped a little bit, so I delayed getting my annual PSA. So in October of 2006, it was elevated to 6.8. I had lots of things on my plate. I had to go to the Western Section meeting to find out if I was going to be the section's candidate for president of the AUA. Turned out I was. My mother was deathly ill, and she lived 2,000 miles away, and I had to go back and spend time with her, and I decided to spend the Christmas holiday with her. So I came back home, and on the 27th had my PSA repeated, total and free. The total was still elevated, the free was 10%. It was time for the Toronto nomogram. So here we are from Urology Times. I simply plugged in all my values on this and found out that my probability of having a positive biopsy was 0.8. So I stopped the baby aspirin I've been taking for no particular reason, called Karen Gates, our urology clinic nurse for the past 2 decades, and Mark Garzada, one of our 3 urologic oncologists, set up a trust-guided set of biopsies in the clinic. So here we are, Wednesday, 7 a.m., January 3rd, 2007. Karen has that condom-covered probe that's going to be shoved up my butt, and Mark has his gloves on, and first he's going to check and be sure I have no stool in my rectum before he does the biopsies. I'd already taken my prophylactic antibiotics. With the first needle pass, after the local anesthetic, I had a vasovagal reaction. They tipped me upside down for about 5 minutes, and then did the rest of the punches. This was my calendar for that day. My general urology clinic started at 8 o'clock. At noon, I had lunch. From 1 to 5, I did the transplant candidate clinic up on the other campus. This was the same-day pathology report, which is not bad for a university hospital. Gleason 3+4, T1C. I had cancer, and I knew too much. I felt as though I were on the edge of an abyss. So after the biopsy, I was sore for a few days, nothing that Tylenol didn't take care of. I had hematuria for 11 days, lower urinary tract symptoms of irritative voiding for 2 weeks, hematospermia for 3 weeks that started out as standard red streaked semen, then became crankcase oil or hot fudge sauce, whatever your perspective. Then it changed to butterscotch sauce and finally cleared. I had a sleep disturbance for 10 days. And what would happen is that I would fall asleep at night at my usual time, awaken at 1 o'clock, ruminating about prostate cancer, to the point where my primary care physician suggested a short-acting sleeping pill, which I took and worked great. So what to do? Watch it, burn it, freeze it, radiate it, or remove it. I talked to a few surgeons afterwards, and Manny Menon had been my friend for a quarter century. I taught his kids how to fish when we were part of the ABU-AUA exam committee in Florida. And so my questions were, how should I have this removed? Where and by whom? I was a high-profile patient for home, and if anything went wrong, it would reflect badly on my institution and on our 3 urologic oncologists. So I talked to Manny. This robotic surgery thing was relatively new, and I decided that I'd like to do it after talking to Manny. And I had one criterion that I didn't tell him about, and that was that my robotic surgeon had to have done as many radical robotic prostatectomies as I have done kidney transplants. And at that time, that was only 2,000, and there was only one person in the world who was qualified to do my procedure, and that was Manny Menon. So I did what any of you would do. I went to Oahu, and I went surfing for 10 days while I was recovering from this and waiting for my inflammation to go away so I could have my radical prostatectomy. We came home, and then my wife and I got on Northwest Airlines, who was still in business at the time, and flew by way of Minneapolis to Detroit. At Detroit, I was met by a Lincoln town car driven by a chauffeur who welcomed me. We checked into the Ritz-Carlton Hotel in Dearborn, where I rented a junior suite for my wife and me, and a single room next door with an adjoining doorway for my physician daughter, who is one of these CSI pathologists in New Mexico. And I ordered the Vattikuti Comfort and Care package. The next day, we went in the limousine, the three of us, for pre-op visits. Then it was back to the Ritz, suppository to empty my rectum, and anxiety. The next morning was surgery day. We were up at 3:30 a.m., back into the Lincoln town car. My IV was started. I was given an antibiotic. And one of the most reassuring things that happened to me was getting my sub-Q heparin in the preoperative holding area. I use this routinely in every patient that I operate on, and I was pleased to see that Manny's team had the balls to do that before radical prostatectomy. My abdomen and thigh were shaved. I began to ruminate. Is this how criminals feel when they're about to be executed? And then, oddly enough, I thought about Saddam Hussein. Why Saddam Hussein? Well, in 1979, he became president of Iraq. And that was the same year I became chair of urology at Oregon. His professional career had ended badly, and I'd hoped that mine wasn't going to follow suit. Dan and Manny came in, and then I was into OR 21, which is of significance to me because 18 months previously I had been a visiting professor at the Vattikuti, and I'd sat in the lounge chair in the room with my glasses on and watched Manny do a robotic radical prostatectomy. Same day as surgery, I awakened, had 6 ports. I was on IV Toradol. Sub-Q heparin was continued with my calf squeezers. I had the usual drain. Yes, I had a Foley catheter, and it didn't bother me. I was euphoric because the cancer was out, and I was alive. I was up walking the halls, chatting with other patients who had the procedure the same day, and inviting families of other patients into my room so we could chat about prostate cancer. I called my wife and daughter at the hotel and said, bring in my laptop, I'm giving urology grand rounds tomorrow morning. So I did. The topic was time management for urologists, and the only person late to the talk was Dr. Menon. I gave SPCP neckties to the residents who had touched my naked body, and I went to the discharge class by Brad Brazy, the nurse. And the only narcotic that I took was because I was told to take it by the nurse before I went to the class so I would be comfortable. And that was it. After that, it was ibuprofen, 600 milligrams every 8 hours for 10 days, and then I stopped and took no more analgesics. The JP and the IV were removed, and before 24 hours had passed since my surgery, I was in the Lincoln town car back to the Ritz. That evening, I walked a quarter mile to the mall with my leg bag, made inpatient rounds with Manny and the rest of the team, saw outpatients with Manny. If they were concerned about having a radical prostatectomy, I simply raised the cuff on the very suit that I'm wearing today and showed them my leg bag and said it really isn't bad. I saw 3 movies. 2 were bad, 1 was good. I had a normal bowel movement. I had a cystogram on post-op day 7. There was no leak. My catheter was removed. I gave urology grand rounds, saw a few more outpatients at the downtown clinic, had some good food, and on post-op day 11, it was time to go home. My bill was a little over $6,000, and it was worth every penny. Ritz-Carlton, back to DTW. I decided to upgrade to first class for the ride home. Post-op day 13, I visited the office, picked up files. Post-op day 16, I was back half-time. 27, full-time. 1 month later, I did the first renal transplant since the prostatectomy. This was my abdomen on post-op day 31. You can hardly tell that I'd been touched. My pre-op PSA, 1 month, and thereafter. It's been a good result. Urine control was not perfect when my catheter came out. The pad on the right, the triangular one, is much more comfortable than the standard D-pens. 4th month, I was down to a maxi pad a day. 6th month, I wore a panty liner, mostly for confidence. 12th month, I was dry. It was like someone had turned off a faucet. And I thought, my God, have I got a bladder neck contraction? The answer was no. So I went to the office with no pad and had the very nurse who'd assisted with my biopsies take a full frontal picture to document my continence. Sexual function, I used a vibrator. I used 2 different forms of phosphodiesterase inhibitors. I used injections. I used a vacuum erection device. 3 weeks after surgery, I had my first orgasm. 6 weeks intercourse. 12 months, my shim score is 27, but chemically enhanced, and it still is. If there's an ejaculate, it's urine, and that's something you should advise your patients about. 3 weeks later, I'd gone back to the gym. 3 months, I was practicing pop-ups in a swimming pool. 5 months later, I was surfing in Southern California at Turtles, just north of San Diego. At 7 months, I wrote a little paper and gave it called 10 Things Your Urologist May Not Have Told You About Your Radical Prostatectomy. Number 5, your wife knows more about pads than your urologist does. And number 8, wear dark blue or black slacks when your catheter is removed. The reason is you may leak a bit. At 12 months, basically back to normal. Would I do it again? Yes. Thank you very much.